With early infantile epileptic encephalopathy, epilepsy means seizure disorder. Encephalopathy means brain dysfunction, often due to damage. And early infantile refers to the age of onset of the disease, which is usually within the first 3 months of life. So, early infantile epileptic encephalopathy, or EIEE, is a disorder characterized by recurrent and unprovoked seizures during early infancy, which can result in severe brain damage. The nervous system is made up of specialized cells called neurons, which receive and send signals from other neurons. The two neurons communicate at the synapse, where one neuron sends neurotransmitters to the next neuron. Excitatory neurotransmitters, like glutamate, bind to the receptors on neurons and tell them to open up ion channels and relay an electrical signal. Inhibitory neurotransmitters, like GABA, can close the ion channels and dampen down electrical signals. The most common causes of EIEE are structural brain abnormalities, like hemimegalencephaly, where one half of the brain is larger than the other. Absence of the corpus callosum, which is a large fiber bundle connecting the left and the right hemispheres, and dysplasia, or abnormal development of the cerebral cortex. Other causes include metabolic disorders like non-ketotic hyperglycemia and mutations in the genes coding for normal development of the neurons. These include the ARX, or Aristillus-related homeobox gene, and STXBP1, or syntax binding protein 1 gene. Regardless of the cause, defective neurons fire synchronously, which is to say at the same time, and excessively, resulting in a seizure. Infants with EIEE typically present with seizures within the first 3 months of life, often in the first 10 days. The seizures can occur during wakefulness and sleep. They're usually generalized tonic seizures, which means that the muscles in the trunk and extremities suddenly become stiff, the tonic phase, and then jerk, the clonic phase. Some individuals might have myoclonic seizures, which cause short muscle twitches. In general, seizures are brief, lasting less than 10 to 20 seconds, but there can be more than 100 seizures in a day. Although the exact mechanism is unknown, repeated firing of neurons causes changes in the synapse, which interferes with normal impulse conduction. Also, abnormal firing during sleep can affect brain areas involved in memory and learning. The end result is severe and permanent impairment in brain function, and a delay in the developmental milestones like sitting and babbling. Diagnosis of EIEE is made with an electroencephalography, or EEG, which is done by placing electrodes on the scalp and monitoring the brain's activity. It shows a typical burst suppression pattern, where there are bursts of high amplitude spikes alternated with periods of suppressed electrical activity. The frequent EEG abnormalities between seizures can also impair development, as the brain never has a chance to be free of disruptive epilepsy waves. Also, brain imaging, MRI is preferred, can identify potential structure abnormalities, and blood tests can be done to look for underlying metabolic or genetic disorders. Unfortunately, seizures due to EIEE are difficult to treat since they usually don't respond to anti-seizure medications. Corticosteroid therapy with prednisolone and adrenocorticotropic hormone, or ACTH, can help control seizures in some infants. Another option is ketogenic diet, which forces the body and the brain to use fat instead of carbohydrates for energy. Although the exact mechanism is unknown, this can reduce seizures in many cases. In addition, correcting the underlying cause whenever possible can help reduce seizures. Regardless of treatment, EIEE usually has a poor prognosis. Some children die within the first 2 years of life, and those who survive are left with severe physical and intellectual disabilities. In survivors, there can be a transition of EIEE into other epileptic syndromes like West syndrome and Lennox-Gastaut syndrome, which have similar underlying etiologies. Alright, as a quick recap, Early infantile epileptic encephalopathy, or EIEE, is a disorder characterized by recurrent and unprovoked seizures beginning in the first 3 months of life, resulting in severe brain damage. The seizures can be very frequent. On EEG, there's a typical burst suppression pattern that can be frequent and can impair brain function. EIEE seizures usually don't respond to anti-seizure medication, so treatment with corticosteroid therapy and ketogenic diet are recommended.